Live here. What up? What up? And another day, another live, another lunchtime preparation. So if you are a regular viewer here, then you know exactly how this shit goes. Where I eat the same shit as always, and so that's the plan, right? We gotta stick with it. Where have I been? Where have you been? I've been around. I've been here. I have always been here. I'm consistent. Secure attachment. I am the rock. I'm stable. What's up? Hey, Ali, good to see you. Good to see you. Damn, I've been on D&D. Yeah, D&D's fun. I used to play back in the day. I definitely want to get into it again. My sister wants to do it too. Good to see you. Looks like we already got some questions rolling in. Can you talk about vortioxetine? Yeah, so I actually just prescribed this to the patient the other day, and they did really well on it, or Trintellix. Basically, it's an SSRI, but it's got these like unique serotonergic, it's in specific receptors, so it's a little bit better than SSRI, and it hits a little bit more selectively, which is nice. Well, let me get the oven running too. Yeah, so it hits a little bit more selectively, which is nice, so people can avoid some of these side effects of SSRIs. Only problem is that it's expensive, so that's the main issue. But you know how this shit goes. Just standard day here. Let's see. Louis says, what medication is this? Sorry, just joined. So this is Trintellix. Hino says, dude, I went on a date with a urologist. I mean, there are so many jokes that I could make regarding that, but I will not, just to spare you the embarrassment of that. But hopefully the date wasn't hard. What made you go into psychiatry? Yeah, so basically when I was in college, I had my own confidence issues and like social anxiety and all that, and I joined a fraternity. And so what I realized from joining a fraternity is that I became a lot more social, more confident, etc. Like I used to be a gamer nerd. Like I was the kid who in high school, like I would go to the lunchroom, or I wouldn't go to the lunchroom. I would go to the physics teacher's room to play chess, or I would go to the computer lab to play computer games. Like that was me in high school. And then in college, I was like, okay, I can't keep on doing this anymore. Like things got to change. So I joined a fraternity. I definitely kind of turned things around, and I still love gaming, but like I knew that couldn't be my life because I wanted to be so social and popular and all that. And then by the end of college, I realized that, hey, I can actually change who I am and like how I act and my thoughts and feelings and stuff by, let me use the tongs here. I can actually change my thoughts and feelings and stuff by changing my actions. And then that led me to med school and psychiatry, because I was like, well, I can help other people change themselves too. So yeah, that was pretty much it. My doctor finally kept me on lorazepam after being on it for 24 years. I'm happy. Nice. Well, I'm glad that it worked out for you. You are triggering my ARFID. Well, then I would just scroll away if it's triggering you, right? Remember, you choose to be around stuff that affects you. You have to throw out those black tongs. Why are black tongs toxic? I mean, I am no chef, so I do not know. Is that salmon? It is. Yes, and yes. Tell me you watch Love Island and need a psychiatrist POV. I don't watch Love Island, but I did watch White Lotus season 2, and I really enjoyed it. So I could definitely I definitely had some observations on that. Fun fact, I actually asked ChatGPT, I was like, I want to watch White Lotus. What season should I watch? And ChatGPT was like, okay, you need to watch season 2. So I said, okay, bet. And I watched season 2, and they were right. ChatGPT was right. Also, I've been taking Chat's advice, and now I defrost all my stuff before eating. I think it makes a difference. Let me wash my hands. Let's see what we got coming in. Yada yada yada. In your opinion, what is the most challenging diagnosis to treat? Probably a personality disorder, because there's no meds for it. Addiction, actually. I think addiction is the most challenging to treat, because there's nothing I can do unless the person really wants to help themselves. And the whole part of the disease is that they don't want to help themselves. Can you watch season 2 without watching season 1? Yeah, I did. Apparently I wasn't supposed to, but you can. Like the storyline, there's like a little bit of overlap, but it's all entirely new characters and stuff. So, I was able to catch up. I love White Lotus, yeah. Safest SSRI for pregnancy, it's Prozac, 100%. Or not Prozac, sorry. Sertraline, Zoloft, and Lexapro. In fact, I have one patient who's planning on getting pregnant. So she's on sertraline for anxiety. And then I have another patient who successfully just delivered a few weeks ago, and she was on sertraline like 50 milligrams. So yeah. I'm taking Lexapro. It makes me really sleepy no matter what time I take it. Then I would take it at night. Then, if it makes you sleepy, then nighttime is definitely the time to do it. What meds are good for ODD with no ADHD diagnosis? Probably guanfacine or clonidine, but most ODD kids probably do have ADHD as well. But at the same time, you got to make sure it's not just a behavioral thing too. Like, are they just being ODD because of impulse control issues, or are they being ODD because of they're just trying to be rebellious and stuff? Or there's like family issues and other things going on. So that's what I would check for. Man, I'm seasoning the crap out of things. How do you decide which tricyclic is best? So if they have a lot of migraines and sleeping problems, I'll go with amitriptyline or chronic pain. If they need a little bit more of a cleaner option, I might go with nortriptyline. If they have OCD, I'll go with clomipramine. If they just need sleep problems, I'll go with doxepin. That's how I decide about tricyclics. Do you know anything about parasites? Yeah, so with some of my patients, I do gut health testing, and that's where I'll check for parasites as well. Because some people can have really bad gut health, and they can have bad bacteria and parasites. And then if they have bad bacteria and parasites, then that can cause anxiety and depression and stuff. Paprika or no, I just don't have any paprika, but yeah, I like my current setup, but I really like the lemon pepper, so that's something I'll look at in the future, getting back at it with the broccoli, of course. What do you mean back at it? This is a day-to-day thing. Always at it with the broccoli. I don't want to grind anymore. Lemon pepper never fails. Yeah, exactly. I just need to order some. I don't have any. All I have is salt and pepper, and I mean, it does the job. So for me, I'm not a big tasty, I don't really care that much about how food tastes. Thoughts on Vyvanse? It's good. Thoughts on Vyvanse? Yeah, Vyvanse is really long-lasting. It's a long-lasting stimulant. And so because it's super long-lasting, it's really good for once-a-day dosing or someone who needs all-day coverage. I wouldn't use it for a person who only needs a couple hours. Like, for example, I have an entrepreneur client, and he only needs Vyvanse for a couple hours. So for him, I wouldn't use Vyvanse. He only needs a stimulant for a couple hours. But then, I have a lawyer client who's like, I can't focus all day. So for her, a longer lasting is better. Pandy says sleep meds for elderly. Good question. Most of them are kind of not that good. Seroquel can be helpful. Trazodone probably. You don't want to use any of the anticholinergics. Doxepin can be used because it's low dose, like 3 to 6 milligrams. It's not bad. Yeah. What you put on the fish, I put salt, pepper. I'm gonna put some garlic on, and then, yeah. Mirtazapine. Yeah, mirtazapine's good too. Mirtazapine's also nice because it can help with appetite. So that's a win-win. What meds work best for anxiety? Typically, you start with an SSRI, but then you can go to other stuff too. SNRIs, benzos, buspirone, hydroxyzine, propranolol. For supplements, you can use L-theanine, magnesium. For natural stuff, you can do gut health cleansing. So it just depends on the patient and like what kind of thing that they're looking for. Oh, hell yes, salmon. Yep. Tune into this channel and every day you will see salmon. Also, just so out of curiosity here, who is a patient, like, and who's a provider? If you're a provider, just like, you know, if you're an NP or a psychiatrist or a doctor or a, you know, clinician, whatever, say 1. And if you are like a patient or like a just a general person interested in this stuff, then say 2. Oh, parsley. NP student, nice. We got 1. If you're a 1, say what you are, like 1 NP student or 1, you know, internal medicine resident or psych resident or something. PA, yeah, PA, 69. It's funny. 2 vascular surgery, PA, nice. Vascular surgery, 1 NP student, nice. Okay, awesome. And so, it's, you know, what kind of content is most helpful to you, especially if you're, let's say, like an NP student or a psych, or especially if you're a provider. What kind of content do you think would be the most helpful for me to talk about and post, just out of curiosity? All right, let me set the timer for 1 psych pre-med. Okay. Prescribing algorithms, interesting. Okay. Yeah. What meds suitable for autistic while being perceived? Talk about moonlighting. PSSD, mirtazapine. Interesting. I am a PMHNP testing individuals for ADHD. Nice. Yeah, that's a good topic too. So, okay, why don't we go through everything advice-wise? Let's go through everything in order. I'll go through reverse order, actually. So if you're PMHP testing individuals for ADHD, so ADHD is what we call a clinical diagnosis. And actually, yeah, I'll keep this up. It's what we call a clinical diagnosis. So what that means is that you don't have to do testing for it. I just think that's a way for a lot of these companies and psych testings to make money. You don't have to do it. Just like you don't need to do GeneSight genetic testing to get medications or prescribe them. But testing can be helpful. The way to diagnose ADHD is through a clinical interview. And so you go through the diagnostic criteria, you check that the person has had the impairment since, you know, for a while, right? Okay, I need to do 15, 16 minutes-ish. They've had the impairment for a while, not just recently, especially if they've had it as a child. You know, I like to ask them about their developmental history, like did they ever have trouble focusing in school? Did people ever say they couldn't focus? They got up and out of bed? So yeah, I just go into detail with the patient. If there's any collateral available, like let's say it's a kid or adolescent, you know, the parent can provide collateral, teacher can provide collateral, you can give them Vanderbilt rating scales. Yeah, so I like to do it because, you know, not everyone needs testing, I think, to help them. In my view is that if I suspect a patient has ADHD and I can help them, then I would rather go ahead and help them rather than like make them wait a couple months trying to get testing and things, because it's not really going to protect you in a lawsuit or something anyway. And you're not going to get a lawsuit really over ADHD. And I would rather go ahead and treat the person as quick as I can rather than trying to put them through this testing. But that's my view, at least. And so that's what I actually, so I have an NP coaching community where I coach PMHNPs, and that's what I actually teach in the community as well. So we have weekly calls every week where people ask clinical questions, case questions. And so I always say, right, like, unless you're like have serious doubts about the diagnosis, if you have a good clinical suspicion, it's better to go ahead and treat them, because you want to get, your goal is to get the patient better as quick as possible. So that way you can really, one, build the alliance with them, and then two, the patient can really be like, oh yeah, like this person, this provider really gets me. Yeah, rather than like just making me jump through hoops after hoops. Explain the academy. Are there learning modules? Yes. So actually, let me just get my laptop. That's probably the best way to do it. Okay, so laptop is here. Da, da, da. Yeah, so pretty much, so this is what it looks like. Let me, hold on. Yeah, so pretty much this is what it looks like, right? So there's a community component, and with the community component, that's where people can ask questions, and yeah, like I'll answer questions that people have. And then there is also, actually it's gonna be inversed. So what I will do is take this. Dude, I am such a boomer. Yeah, so there's a community component, and there's also a classroom component. And the classroom component is something that where a lot of people get value from. So there's diagnostic assessment, and this is where I cover pretty much every psych diagnosis. So anxiety, ADHD, binge eating, bipolar, catatonia, depression, etc. So let's say we go to bipolar, right? Bipolar, so bipolar 1 diagnosis. And so here I explain all about bipolar diagnosis. There's a video, transcript, and then also a PDF handout that you get where I go into bipolar disorder, explain the diagnostic criteria, you know, how to diagnose it. So that's the diagnosis section. Then there's psychopharm, and so that's where I go into pretty much every single psych med that's out there. So let's say you have a patient on bipolar, and you're like, oh, I want to start them on Geodon. Can you explain Geodon? So I'd be like, yep. So there's a video explaining Geodon. Here's a transcript of it too, of the video, and then also of the resource here. So this is pretty much explaining Geodon in detail, right? So the dosage, like for example, bipolar mania, start 40 milligrams BID. Schizophrenia, start 20, right? 10 to 20 for acute agitation. Dosage forms, or this is how it works, right? Histamine, a little bit, alpha-1, dopamine blocking, etc. Dosage forms, right? 20 milligrams, 40, 60, 80, etc. So pretty much every psych med, it's my goal is to download all the knowledge I learned from residency and fellowship to you, because a lot of NPs have told me their education was not good and they weren't happy with it. So, you know, I don't want you to feel like unconfident or feel like keep on feeling stuck with patients. So, you know, some advanced stuff, some business strategies, tapering, cross-tapering meds, how to adjunct meds, pharmacogenomic testing. I explained GeneSight and GenoMind here as well, like how to interpret them. Holistic psych, so I cover some nutrition stuff, nutrition, diets, intermittent fasting, and then so you can explain to patients in a whole bunch of different supplements. Yeah, so for example, you're like, hey, I want to prescribe omega-3s, but I don't really understand them. I'd be like, boom, okay, so here's a lecture on omega-3s, and then here's a handout explaining exactly how to use omega-3s and what they would be used for in clinical practice. So that's the holistic psych. Then there's also case discussions, and then in the case discussion, these are actual cases that I've taken care of, and so I explain exactly how I took care of the case, what I did, my thought process, my clinical reasoning, and so that's how you can really learn. And then, I think what's the most important is the Q&A calls. So every week we have a Q&A call where people will ask questions, and I will literally just I'll answer people's questions, whether it's like cases or explaining different psych modules, et cetera, et cetera. Explaining medications. The case reviews are really helpful because then, instead of feeling stuck on a case, now you can actually ask a psychiatrist about the case. So so pretty comprehensive. My goal is to download all of and we're getting industry lectures too. So, we just had Genomind company talk to us a couple days ago about Genomind, how to use it, pharmacogenomic testing, etc. And then in 2 weeks, we have Caplyta. So Caplyta is going to talk to us as well. I'm going to be talking with esketamine, Spravato too. And so hopefully they will come and give us a lecture. But pretty much just a full community of me explaining all of psychiatry and us supporting each other as a community. So if you really want to learn psychiatry, like if you're serious about leveling up, that's what I call it, Level Up Psych Academy. If you're serious about that, then this is the place you want to join. Especially if you're tired of not feeling confident around patients, if you're tired of not getting good education, if you're tired of people not respecting you, all of that. So people not respecting you because they're like, oh, you're an NP, I don't trust you, which a lot of my students have gone. So, the only way to counteract that is by leveling up your skills so much that no one can doubt you. But yeah. Some factors that may divert you from using stimulants as first line besides heart problems. Yeah, addiction, sleep problems, all of that. Those are all factors that can make it harder. Studying to get into med school, nice. This guy's 3 phones, red flag. Yeah, I'm a walking red flag. Yeah, let me know what questions you have, especially as a provider too. General surgery PA here, wish we had a site like that for surgery. Yeah, there's nothing really like that for psych, so that's why I started it. Because I had so many NPs come up to me and they were like, hey, no one ever teaches us psych, no one tells me anything. My preceptor was complete shit. They just took my money. My collaborating psych just takes my money and doesn't teach me anything. I had all these messages, and I was like, I was fortunate to have a really good education going through the medical system, like residency and fellowship. And because the difference is that our education is standardized, and so because it's standardized, you become confident by the end of it. But in your education, some people get really good education, but others don't. So, imagine if you're a nurse, you want to go to NP school, and you're like, hey, I want to learn, but no one, or the education ends up being crappy. So it's not your fault. But then now the education ended up being crappy. Now you're struggling trying to pick up the pieces or just trying to figure it out. Like you're like scrapbooking your education from here, rather than just going through the pipeline. And so that was my whole idea about creating the program, because I was like, this is a problem and we need to fix this problem. What is your view on ketamine and TMS therapy? So I think they're good second and third lines. So I do telehealth, so I don't start with that stuff. But if I have a patient who is like, they've tried a couple things and it hasn't worked, and I think they might be more severe, like let's say they have SI, then I might push those a little bit more, like the ketamine or the TMS, because I'm like, okay, I think we need to be a little bit more assertive. So I think they're good. I think they're good interventional stuff. I just don't do them personally, but I refer patients to them. Do 5-HTP pills work for anxiety? It's okay. 5-HTP, the absorption is not that good. Basically, 5-HTP is a precursor to serotonin, but the absorption may not be as good, so you may not get much benefit from it. I think if you take L-methylfolate, you'll get better benefit, especially if you're MTHFR deficient, because that can help you replenish your serotonin. And if you take magnesium or L-theanine, those will be more helpful for anxiety. Can you stop Lexapro cold turkey? I wouldn't. Does Intuitive cause weight loss or sleep loss? Intuitive should actually help sleep, actually. Intuitive's more calming. It's a calming intervention. It's what we call a sympatholytic. So basically it calms down the sympathetic nervous system. My doctor increased my doxepin to 100 milligram from 50. Will that help my sleep? No, doxepin is really just good at the early doses, like 3 milligrams, 6 milligrams, 10 milligrams for sleep. As you start getting higher doses, you start getting more into norepinephrine territory, and that tends to not be as effective. Legally, can I force a schizophrenic into long-term treatment? I mean, if they are a danger to themselves and they're decompensating, then yeah. Thank you for choosing psych. I appreciate that. Yeah. I mean, psych is pretty competitive now. So, back in the day, people didn't want to do psychiatry, but now it's competitive. So a lot of med students want to do psych. I think that med student or med school or psych, mental health in general just has way more appeal. So people are really interested in mental health in general. So I think that's the main reason. But that's any antipsychotics that don't have weight gain. Yeah, Caplyta doesn't have weight gain. Abilify is a little bit. It's mild to moderate. But Caplyta, Vraylar, yeah, those would be the ones. Cobenfy now. Indications for Ampheta above the FDA max 60 milligram dose for ADHD. Yeah, you can use it. FDA max is just a guideline. FDA max. So if you're a provider, this is really important. I teach this a lot in my program. Is that the FDA max is just a guideline. Like that's just what the studies were done on for the pharmaceutical company to get the medication approved. Like that's it. That's all FDA max means. It doesn't mean that you absolutely need to take this dose to the max. Like that's all FDA max means. So I have plenty of patients who I treat above the FDA max because they need that dose. And patients are individually different than studies. So once you become an experienced provider, you'll understand that there's times when where you have to go beyond the rules to help the patient. About Abilify, just started. Any side effects to look out for? Yeah, akathisia is the main one, basically restlessness. I've been pharma rep for 27 years. Psych and neuropsych are my favorite. Yeah, I appreciate that. Everyone's it's so interesting. Medical specialties attract different personality types for sure. PMHP means psychiatric mental health nurse practitioner. That's what PMHNP means. Talk to me about dosages on Vyvanse. Yeah, 10, 20, 30, 40, 50, 60, 70, 80, 90, etc. Dude, bupropion got me feeling like a human again, says Julian. Welcome. Why neurologists prescribe antidepressants for trigeminal neuralgia? Because they have nerve pain properties. The norepinephrine ones do. How do you learn to live with the effects of PTSD? You learn it, right? You have to. It's kind of like, how do you learn how to be a parent? Well, no one teaches you how to be a parent. You just figure it out as you go. So similarly with PTSD, you do the treatments for it. You do therapy. You do your medications. You do grounding exercises. You do yoga. You do somatic therapy. Calm down your nervous system. You do supplements. Like basically, you just do all of that to help treat it. I am now escitalopram 20 milligrams, 2 weeks for my anxiety, but I don't feel safe. 2 weeks is just starting. It might take a little bit of time. My doctor isn't helping, so I request a new psychiatrist. Yeah, that can happen a lot. So I see, for example, a lot of patients for second opinions in my practice because that's my timer. Yeah, I see a lot of patients for second opinions in my practice because a lot of patients are fed up with their psychiatrist, typically because they're in the insurance system, or they just see them for like 15 minutes, or they don't know that much, or they don't listen to them, whatever the reason is. And so I see a lot of them because I do a lot of integrative psych work. So I do, share medications, but also supplements, also detailed testing. Like I do a lot of gut health testing, nutrition testing, functional medicine testing, infectious testing, all of that. I do genetic testing. So people really value that holistic approach. Are there any non-addictive sleeping pills? Yeah, doxepin, trazodone, mirtazapine. Most psych don't like to RX more than one stimulant dosage per day. Do you find that accurate? Yeah, because then you have a lot of ups and downs for stimulants. Like you go up and down. Nice haircut, thank you. Maddie, like the first day. Oh yeah, also thank you for liking. Do you peep the YouTube chat? I do, but it's all trash. How do you test gut health? So I do what's called vibrant gut health testing. And vibrant gut health basically tests for bacteria and make sure that people have good bacteria, not bad bacteria. Because the bad bacteria can worsen your gut, and the gut is where 90% of the brain's serotonin is made. So if there's any gut health problems, you're gonna have brain health problems, aka depression, anxiety, etc., etc. So I have plenty of anxiety patients I've treated through probiotics and fiber and gut health cleansing. Do you offer preceptorship for PMHP students? So I don't do any preceptorship personally, but it's something I might consider in the future, like either being a preceptor or a collaborator. But that would only be open to my students in the academy because, you know, I want to work with people who I already know and who I trust. And so, you know, the students in my academy, they're the ones who I really want to serve. But if you want to, you know, so if you want to really do that, like if you want to find good preceptors, a good way to do that is to join the academy, because then you can network with other NPs, and like we have NPs all over the country. So you can find someone who can connect you to a preceptor. Did you go to USA for med school? I did. I went to University of South Alabama, yes. At what point does dementia become unethical to take power of attorney, or what constitutes being able to take power of attorney from someone with early dementia? Basically, if they don't have any kind of say or understanding of what their situation is, and if they can't make good medical decisions for themselves, that's when you can take it. So you can take it in early dementia, you can take it in late dementia, but basically when they start understanding their illness and they start making illogical choices, it's called capacity, without understanding why they're making those choices, then, you know, that's when power of attorney can be taken away. All right, so we are cooking, or we have cooked. We cooked, chat. Cool, thanks, yeah. What's the best sleeping med for insomnia? There's more than one. I like trazodone personally, it's my favorite. You are a very healthy eater. Yes, of course. Of course, you know, summer is here, so we got to. Yeah, don't get it twisted. It's all just narcissism and yeah, aesthetics. Trazodone I have a psychiatric nurse practitioner. Is it better to switch to a psychiatrist? Not necessarily. Just depends. If you're happy with your care, that's the most important thing. Do you deal with multiple sclerosis, or how does it affect the brain? Can it cause dementia? Yeah, multiple sclerosis can definitely cause dementia. Every time you have an episode, it can worsen dementia. So let me take that out, and then let me take this piece out as well. And then I think that the rest, what I'm gonna do is I'm gonna put it back in the oven so it stays warm at least, and it doesn't cool. I might get out the chicken too, just because the chicken will dry. You know, dry chicken is the bane of my existence. Let's do one question at a time, please. Are you looking to hire a therapist? I am not, no. What do you recommend for OCD? If you want supplements, N-acetylcysteine. If you want meds, SSRIs. How do I find a psychiatrist that will actually prescribe my ADHD meds even though I'm nursing? Well, you work with someone who treats ADHD. Simple. And like if you have ADHD, they'll prescribe it, right? You also have to work with someone who's comfortable with it. A lot of psychs are not comfortable with treating ADHD for whatever reason, so you might just have to ask them. Yeah, I've noticed that a lot of the older psychs, they have a stigma against ADHD treatment. I'm not sure why, but yeah. Do you reckon BPD is overly diagnosed? Probably underdiagnosed, to be honest. Is that Soho? It is not Soho, but that's a good guess. Actually came out really good. It's not too dry either. I used to put it in for 25 minutes, but that was too much. I think 15 minutes was a sweet spot. Is Strattera good medication for ADHD? Yeah, it's good. I like Strattera for my non-stimulant patients. Recipe, pretty much I did salt, pepper, garlic, and parsley. And then I just got the frozen chicken tenderloins from Costco, which I thaw out the night before, and then just pop in the oven for like 15 minutes. I'm no chef. For me, food is just function, but I want it to taste reasonably good. I don't have high expectations. Are you taking new patients? Yes, I am. So if you want to work with me, best way to do that is in my, just send me a message. Here, I'll put up my thing. Or you can just check out my bio, and then there's a link in there for a consult. So the best way to do that is to book a consult, and we can see if we're a good fit to work together. I can't stop my anxiety without clonazepam 1 milligram. Yeah, some people have anxiety more severe. Do you reckon medication should be a last resort or early on? It depends on the patient. It depends on what they want. Some people, they want medication early on. Other people, they want to do more holistic stuff first. So my number one thing that I believe in is patient autonomy, which is like what does the patient want? That's what I believe in. That's what I teach my students too in my PMHP Academy, is that, you know, the patient, ultimately they're going to do what they want to do. So imagine if you have a charging bull, you want to work with the bull and go in the bull's direction. You don't want to be turning the bull around 180 degrees to fit your thing. So usually whatever treatment the patient wants to do, like whatever avenue they want to pursue, that's the avenue that I guide them towards. Because I'm not the savior or anything of anyone. I'm just a guide helping the patient along their journey. And that's what I teach, at least in my academy. That's my philosophy. What do you recommend for akathisia? Propranolol. That's usually the best one. Or reduce the dose of the akathisia medication. Usually it's Abilify, sometimes SSRIs. I had a patient recently who developed restless legs on an SSRI, and she had low iron, so that made sense. So we started an iron supplement. You get gut feelings, patients are lying about symptoms? Yeah, of course. But, I don't judge. People have their own reasons for not disclosing. I would just say if you want the best treatment, you should probably be honest with your psych, because that's the whole reason you're going. Why did you decide to eat while doing TikTok? Same reason you decided to go live at this point, right? It is what it is. I just like, but if you want a deeper reason, it's, food is meant for people to bond together, and the best food is shared with people. So now I'm eating and sharing this with you. So you could eat too. It's around lunchtime, so you could definitely eat. Also, definitely like the live. If you find this helpful or you like it, just double tap the screen and you can like it, and then you can share it. Yeah, see, Morgan's eating chicken, so we're literally eating together right now. We're sharing a meal. Can MS be hereditary? Is it preventable? MS, I'm not an expert in MS, right? I'm a psychiatrist, not a neurologist, so I don't really treat it. But my understanding is that it's hereditary. Is that salmon? Yeah. You give healthy meal ideas. I literally eat the same shit every day, so I give you one healthy meal idea. That looks so good. Yeah, I think so. See, the thing with healthy food is that, carbs and all the other stuff, like, junk food, you can make healthy food good too. It's not just chips and pastas and things that are good. What do you eat every day? Keep watching and you'll find out. Our psychiatrists also know Taylor Swift. Oh, put lemon on your salmon. Oh, damn, I have some lime juice I was gonna put on. I don't have any lemon juice, or any lemons, but I'm gonna get it. Do you think my question is stupid? I think you were trolling. Eat on the balcony. Yeah, it actually is pretty warm. I just don't have a place to set my phone while I'm eating. Yeah, it actually is pretty warm. I do eat on the balcony sometimes, especially in the summer. I was thinking of setting up like a live stream studio actually on the balcony, like a nighttime New York stream. I was thinking about that too. That was a future idea. It's too hot. Yeah, it's fine. I get more cold than hot. Awesome. Thank you for the like. Appreciate it, Maddie. Me too. I'm so anxious about my autism assessment in a few weeks' time. Eek. Nah, I wouldn't be anxious about it. I would just go with it. That's the whole idea. Because remember, you signed up for it for a reason. I do 1 meal a day. Sent you a serious new patient request. Awesome. I'll have my assistant look through that. Yeah, basically you just have to book a consult. That's the best way. Thoughts on TMS? I'm actually going to be doing a live stream on TMS next week with a patient who had TMS and a guy who administers TMS. So definitely stay tuned for that. It's next week, next Thursday night at 10 p.m. Eastern Standard Time. Do you ever switch up your foods? No, not at home. I only switch up my foods when I go out. No, so the best way, if you look at my bio, you can see book a consult. So you have to book a consult. 1 meal a day, you don't have breakfast. This is my breakfast. I don't eat breakfast. No, I think breakfast is overrated. But if you really think about it, breakfast is break fast. I'll repeat that. Breakfast is break fast. It's literally when you break your fast. So breakfast could literally be at 6 p.m. at dinner time because it's break fast. Where's the best medicine for bipolar 2? So for bipolar 2, I like Latuda. I mean, Seroquel is my favorite, but it causes weight gain. So I like Latuda a lot. Some of the newer ones are coming out, like Vraylar, Cariprazine. What's the other one? There's Vraylar and then Caplyta. Caplyta. Yeah, so that one's good too. You can use lithium and not Depakote, but you can use lithium for bipolar 2 as well. But I like Latuda and Seroquel. Oh, and Lamictal as well. You can use Lamictal. Best medicine for depression and anxiety. There's no best medicine. It's whatever works for people, but there's different options. Do you have to go to treatments or medications for ADHD? Do you have go-to treatments or medications for ADHD, anxiety, and depression? I mean, that's a very general question, right? Because there's so much. But if I'm going through a treatment algorithm, generally for ADHD, I'll do stimulants. But if the patient wants non-stimulants, we'll go with non-stimulants. For anxiety and depression, start with an SSRI. But if they need something more stimulating or more sedating, I might use mirtazapine or Wellbutrin, bupropion. So it just depends. Depends on the patient. What did you notice benefits from one meal a day? No, I just like eating big meals. That's all. So it's more fun for me to have one meal a day. Like I like eating a lot and then feeling full. So that's why I alter my eating window and diet to accommodate my preferences. But I was chewing. Alexa says, "Do you use algorithms for your patients?" Oh my god. Thank you for the hat. Basically, I'm like reading a question and then it'll like scroll to the bottom. Do you use algorithms for your patients? I'm a new Psych NP about to start in a few weeks. So it depends. So algorithms are generally a good baseline, but then once you become more experienced, you know when to stray away from the rules, right? And so similarly, let's say I have a patient who comes in with ADHD. And so the algorithm would say, okay, start a stimulant. But now the patient tells me they don't want a stimulant. So I'm like, okay, well, maybe I need a non-stimulant. Or they want something natural. Well, I'm like, okay, well then maybe we need some L-tyrosine. Maybe we need to do more habit kind of stuff. Maybe we need to change up diet to have be a high protein diet, low carb diet. So maybe we need to do gut health testing because their gut health is absolute crap and they're not being able to produce the amount of neurotransmitters that they need. So basically, I have like an algorithm in the back of my head, but you tailor it to the patient. That's what makes you get unique here. That's why people are seeing me and not ChatGPT. That's why they come to see you and not the PCP, because the PCP will go with the algorithm, but you as a psych provider, you are the expert here. So that's when you know when to stick with the rules and when to deviate from the rules. Algorithms are just guidelines. They're not dogma or law. So, if this kind of teaching interests you, like learning psychiatry from a psychiatrist, then definitely look at joining our NP coaching community, because I go through this stuff every week in our community, like on our live calls. My students will ask me questions, I'll answer them, they'll ask me cases, and basically just taking all the knowledge that I've learned from residency and fellowship and downloading it to you. That's my whole goal, is to give you that level of knowledge and experience, because I've had so many NPs tell me that, hey, I don't feel confident starting, I don't feel comfortable, I feel like patients are going to judge me, I feel like other providers are going to judge me. And so you don't want to feel that way. You don't want to keep feeling like crap all the time, or feeling like your education wasn't good. So that's my mission, and my goal is to fill in that gap of the educations, because I think that NPs get a lot of hate. They get a lot of hate from other providers, from patients, and we're all here in this together. Like, there's more than enough patients for all of us. And so, other psychiatrists and doctors told me that I'm a disgrace to medicine for working with NPs and teaching NPs. And so I was like, well, this is stupid. There's more than enough patients for all of us, and we're all gonna be working together anyway. So why don't we teach each other rather than trying to gatekeep knowledge? Can I take a stimulant with Seroquel and sertraline? Yeah, that's fine. That's not usually a problem. Dude, your arms are perfect for an IV access. That's funny. Thank you. Hello from California. Hello from New York. What would you recommend for binge eating and compulsions, ADD, depression? Is there one med for all that? No. There's not one med for all that. That's like saying, is there one med for cancer and heartburn and I don't know, like a broken leg? Like, no, those are different conditions, so they have different things. Damn, I think the 15 minutes really hits the spot. That yesterday I did it, or 2 days ago I did it for 25 minutes. That was too long. But 15 minutes, 400, oof. Hits the spot, very juicy. I don't see carbs on your plate. Yeah, I don't really eat carbs. Can I take a stimulant with Seroquel and sertraline? Yeah, you can. Yeah, you can. I think I answered that one already. Hi, can you tell when a woman is autistic? I mean, if I do a detailed assessment, but not just on like looking at you. I would like to join. Yeah, so if you want to join, best way to join is to send me a message, or just look. You can look in my bio and you can see the link there. Smoke detector. I don't see. I have no idea what you're talking about. How do they test for ADHD in women? I mean, same way in men. You just go through the diagnostic criteria. ADHD is a clinical diagnosis. It doesn't need testing, quote unquote. More salmon, huh? Just you wait. My trainer said carbs are important because they make carbohydrates and muscles look better hydrated. I mean, that's true. But I feel shitty when I eat carbs, so that's why I don't eat them. Plus, it's additional calories. And plus, protein becomes carbohydrates in the body anyway. So I'd rather eat protein rather than just carbs. Because, I mean, the summer's coming up. I'm trying to get leaner. So my goal is to focus in on the ingredients that matter. Do you take supplements? I do. So I recommend everyone take an omega-3. I mean, I eat a bunch of salmon, so I stopped taking that. But like, if you don't eat salmon, then yeah. Multivitamin, greens powder. I have vitamin D deficiency, so I take vitamin D. I have iron deficiency, so I take iron. I also take hair loss medications. That's the bulk of it. I try to get a lot of sleep, like 8 to 9 hours of sleep each night, and I try to, like you literally watch me eat. So like you've seen the shit that I eat. So I eat that stuff all day, and by eating this stuff, I think it helps take care of my skin, and helps me supplement. Like I don't need supplements because I eat very clean. But I certainly recommend supplements for people if they have specific conditions. Why is my psych not helping with my ADHD? I'm gonna crash out. Then I would recommend getting a new psych. It's just like a dating thing, right? Like if you feel like your partner's not meeting your needs, you don't stay with that partner. Like it's as simple as that. And so that's what I see a lot of people for second opinions, because they're like, hey, no one's, I feel like my psych isn't really helping. So yeah, if you want a second opinion, definitely look at booking a consult. You can do that in my bio. That's the best way. All right, let's get the salmon here, and then we got some of the broccoli here as well too. Yeah, here. Let me answer a question while I'm putting. I'm diagnosed. Do you take any medication? Yeah, so I take hair loss medication. That's the main thing that I take. I don't take any psych medications. Yeah. So I take hair loss meds, of finasteride. I take it orally. And then I take minoxidil also orally. And then I use topical minoxidil on my hair. And I use topical finasteride too. So yeah, that's because my hair is important. And yes, so I think I read something. You're the only one capable of curing yourself at the end of the day. Right, exactly. Yeah, so you're the only one who's able to help yourself, basically. That's the comment. Remember, don't take a victim mentality, right? Like complaining and saying, oh no, I have this and this. We all have problems. And taking a victim mentality doesn't help with solving the problem. It just helps you feel good about having the problem, but that's not gonna help get rid of the problem. I'm a stinky. Stinky says, I'm a behavioral therapist studying psychology to become a BCBA. Do you work with any BCBAs? I do not. No, I do mostly telehealth psych stuff, so I don't really work with BCBAs. Yeah, for me, I always kind of wanted to do my own thing. I was never interested in having like a big practice. I have sickle cell, 70, I feel like, well, I need some kind of therapy. Yeah, like everyone's got issues. Like no one's perfect. I've done my own therapy and stuff too. You just have to identify what the issues are and do what you can to solve them. That's it. How long did it become you to become a psychiatrist? Too long. I did college and then med school, then residency, and then fellowship. So 13 years after high school. So I finished my fellowship at 31. Can someone with bipolar disorder have a successful life? Sure. Like I know doctors with bipolar disorder. Like I've treated doctors with bipolar. Schizoaffective bipolar type diagnosis, lithium adherence. Okay. Why do people watch men eat on TikTok? Why do people watch models go on OF? Like people have their thing. But it's not that I'm eating. I'm not eating. I'm dishing game. Look into Celtic salt. I got my Himalayan salt. I like this a lot. But I was in Iceland last week, and Iceland had some really poppin' salt. Like they were selling salt everywhere. Did you have a hair transplant? I did. Yes. Salmon Spire. Damn. Hey, you skipped over my question. Well, there's 150 people here, so questions are definitely rolling in. So the best way, if you want me to really prioritize your question, best way to do that is to subscribe, because if you subscribe, then I'm able to see that a subscriber is answering a question or asking a question, and it'll cue me into your message more than everyone else's. Like Dog Mom 2020. So they're a sub, so I see their stuff over everything. Do I get tired of eating the same thing every day? No, I don't. I'm a creature of habit. I think men in general are creatures of habits. Hey, I'm eating too. See, we're eating together. That's why I eat on TikTok and do this, because now we're sharing a meal together. Do you believe anything is possible? Yes, I do. There's a book called Think and Grow Rich, and basically its idea is that you should always be thinking bigger than you are, because that will inspire you to get there. Accepted to NYU Psych Postmasters. Nice, congrats. Do I know that psychologist? I do not know. That's such a random psychologist. I don't know them. TikTok seems bad for attention. It is bad for attention. Doom scrolling is terrible for it. Can saffron act as an antipsychotic? No. It's mainly an anti-anxiety, antidepressant. I'm Harvard Neuroscience. Nice, good luck. You are very disciplined. Have you always been this way? No, I have not. I was a gamer, gamer nerd back in the day. But I realized that instead of trying to level up in a video game, if I try to level up in real life, then that's what's ultimately going to make changes. I could get the best trophy or whatever in a game, but then as soon as I log off the game, I'm still shit in real life. So I realized, okay, it's better for me to level up in the real world, and this is my grinding, rather than trying to level up in a video game. I have OCD as working nurse. What games did you play? I used to play a lot of Pokemon. A lot of single player games, a lot of Witcher 3 I've played, Resident Evil. I'm playing a game called Plague Tale right now. I mean, it's such a super niche game, but if you know it, you know it. So I'm playing that. I was going to play the Mass Effect trilogy next. That's on my next for you. RuneScape. I played at RuneScape, yeah. If you weren't a psychiatrist, what would you do instead? I would be a YouTuber. That's what I would have done. Like if I could go back and do it again, I'd be a YouTuber. And like just talk about self-improvement and improving confidence, fitness, doing better in college, fraternity life, Greek life, how to study well, basically just like self-improvement type of topics. Favorite antipsychotic to prescribe? Seroquel is my favorite, but it's got weight gain associated with it. Why do I feel tired and hate people? Well, because you keep repeating that in your head. You're literally saying, I'm ugly, I hate people. So if you keep saying it, you're literally manifesting that into the world. Why not say that I look great and people love me? You can still be a YouTuber. Now I'm a TikToker, but yeah, so you are literally creating that negativity in your head. Remember, words have power. I firmly believe in self-improvement. Yeah, I do too. Self-improvement is leveling up. Do you ever check testosterone levels in men? All the time. Literally, I saw a patient yesterday. I ordered testosterone levels for him. You just paraphrase the biblical principle? Yeah. See, all the knowledge is the same. The truth of the world is the truth of the world, and it's been passed down from generation to generation. Whether we call it biblical, whether we call it science, whether we call it spirituality, whether we call it video games, the same wisdom gets passed down from generation to generation. It's just different forms. You can make contact like the one doctor from the UK. Yeah, you're talking about Ali Abdal. Yeah, I could. I just have to be intentional with my time. And I was making YouTube content for a while. I was doing gaming content. I was making content on how to help moms, help their sons. But I decided to go all in on TikTok. Seroquel knocks people out. Yes, it does. That's why I take it at night. Habits make up 90% of your success. Yeah, exactly. See, I eat the same thing every day. So that way when I get tempted to eat pizza and burgers or whatever, my habit is to eat this shit every day. So that literally does it. Dr. K is the best. Yeah, he's crushing it on YouTube. What's your phone number for Zoom appointment? Best ways to book a consult, so you can send me a message for a consult. That's the best way to do it. Send me a message or just check it in my bio, either or. I eat salmon every day, but I got sick of it. Yeah, you can always change it up. That's why I mix it with like protein or with chicken and broccoli. So kind of rotate. Hey doc, I had salmon and broccoli lunch because of you. That's so funny. I'm gonna screenshot that. Thank you, Betty. That's so funny. That's hilarious. Are you practicing in Canada? I live in New York. But sometimes with Canadians, I'll consult them, and usually their PCP will do the prescribing. Is there an antipsychotic that doesn't make you gain weight? Caplyta, Vraylar. Aripiprazole can make you lose weight. Yeah, sometimes aripiprazole can be weight neutral. Tried Ritalin for the first time today. Nice, hope it went well. Always lighthearted. Yes. Remember, you choose your perspective in life. Okay, here's some game for you. Basically, imagine a thought is coming in, and now let's say that you think that, okay, you are terrible. So now you have one person who says you're great. You'll completely ignore that because it has to pass through the filter of, oh, I'm terrible. Versus another person says, hey, you look kind of tired. That will immediately go through your filter, like a water filter, and then you'll hear, I'm tired. But you completely ignored the person who said, I'm great, because your filter blocked it. So you have mental filters, mental stories you tell yourself that block out certain information. So what you need to do is you have to change the filters. So just like you can make a water filter tighter or different, and you can change the filter to make sure different things come in, you can do the same thing with your thoughts. So if you think positive thoughts, like you think things are great, things are wonderful, then you'll start attracting more positivity to your life. Versus if you think negative thoughts, then you'll attract negativity to your life. So always be aware of the thoughts that you tell yourself, because your thoughts are the diet that you feed your mind. So why would you feed yourself, just like you wouldn't feed yourself poison, you wouldn't feed yourself, don't feed yourself poison thoughts either. Is it because your brain is going to believe the negative or positive because of survival? Precisely. It's called negativity bias. We are tuned to think negatively because that will help us survive. Let's say in the back in the old days, they're like, hey, there might be a saber-toothed tiger there. It's better for me to believe there is and then move rather than go check it out and get killed. But now in the modern day, where at least our physical safety is a lot more assured, like we're not in danger of dying, at least in the America, the negativity bias gets overrun. And then news companies will also overrun the negativity bias because the news companies will feed you negative news to make you feel like the world's worse than it is. Don't feed yourself poison thoughts. Exactly. Tips to enhance the benefits of Vyvanse? Yeah, get better night's sleep. Like for example, if I sleep well and I take a caffeine, like in the morning as a pre-workout, like I feel great. But if I don't sleep well and I take a pre-workout, then like I barely feel anything. And it's the same thing with Vyvanse and stimulants too. Like one of my patients, he's a lawyer, and he says, yeah, on the days he sleeps well, he notices his Adderall like really working well. But then the days he doesn't sleep it, he says he can't even tell. Do you have dessert? Yeah, you're about to see my dessert in a while. It took me years to get rid of my negative thoughts and behaviors. Yeah, it's constant practice. Sleep is so important. I think it's the most important thing. I think sleep is more important than diet and exercise combined, in my opinion. If I eat crappy or whatever the day, like, I'll feel kind of crappy. If I don't exercise, it's like whatever. But if I don't sleep well, like I feel like the whole day is a waste. Oh, here's some other game. When you sleep well, your food cravings go away. Like they go away like crazy. Like I remember one time I didn't sleep well like 4 hours, and then I went to lunch or I went to food, or sorry, I went to work, and me and my coworker were looking at DoorDash and something, and I was like we should get some Chinese food, and so she said yeah, and so we literally had like the greasy ass Chinese food, and I was like, I never eat Chinese food. I never feel a craving for Chinese food, and it's because I didn't sleep well. And like ever since then, I always remember that. Yeah, when I sleep well, like I can eat this stuff all day. But if I don't sleep well, like I don't want to eat salmon and broccoli. Love psych, want to become a psych NP. Awesome. Yeah, I have a coaching program for psych NPs too, teaching them psychiatry. So definitely be on the lookout for that once you enter NP school. Are you American or Canadian? Both. I grew up in Canada, but then I moved to America. So I'm a dual citizen. No carb at all. Just wait. See the OG viewers. Nice job not scraping your teeth. It's easy to get into habit. Yeah. So see, that's how you self-improve. That's how you level up. Because now I'm very cognizant of not scraping my teeth because you've told me, and people and the chats told me, and so I'm like, oh man, I scrape my teeth, so I need to stop doing that. How many psychiatrists doing what you do, coaching? None. There's pretty much no one doing it, because a lot of psychiatrists, they have beef against NPs. They feel like they're out stealing their jobs. And so they're like, don't teach them, let them burn, let them suffer. They're scope creep in that. But I think they're just jealous. And yeah, I think they're just jealous. And they're just being haters because they feel like they're just gonna like take their patients away. But there's more than enough patients out there for all of us. So yeah, no one else is really doing this. How's your pre-med stats? I mean, I took the MCAT and stuff over 10 years ago. Bro, like I entered med school at 2015. So my stats are probably not relevant. They're probably inflated. Do you hire other psychiatrists to join you? No, I don't want to be an employer. That's not my goal. I'm not trying to have a big practice or anything. What do you coach? So I coach PMHNPs. I teach them psychiatry. So I teach like nurse practitioners, psychiatry, specifically Psych NP psychiatry. So if you want info on that, you can just send me a message or just look into my bio. It's in there. You are your generation. Yes, I am my generation. Like, did you do well though? Yeah, I did well. Yeah, I got into med school the first time. I had like a 3.8 GPA. I had a 33 on the MCAT, which doesn't mean anything now. But it was like 90th percentile. And I got into our 2 state schools in Alabama. Oh, damn, I scraped. Shit, I'm cooked. Well, that's why you gotta level up. It's the world's competitive. The world's competitive out there. Like this, life is a competition. Don't get it twisted. Oh my God, are you still in Alabama? No. I did my undergrad and my med school in Alabama, but I've moved. Are you in Alabama? Would you recommend ADHD meds to kids or supplements? Depends on how severe the condition is, how much trouble it's causing. Did you experience racism there? No, I went to a big city. I had some great friends, so I didn't experience much racism. Things are it's 2025. I mean, I went in like 2011, and yeah, things were pretty good. Get ready for that broccoli the next morning. Yeah, I think I've desensitized to broccoli farts. Excuse me. How to deal with someone who has psychologically disrespected you? Was that the question? I missed it. Well, you don't. If they psychologically disrespect you, you don't need to deal with them. Remember that your attention is the reward. So when you continue to see someone who's disrespecting you, you're basically telling them that it's okay because you're gonna keep seeing them. So you need to distance yourself from that. Classic ADHD. Yeah. So for example, I have a 10-year-old, 11-year-old has severe ADHD. Like they're moving around the class all the time. They're just getting into fights with other kids, really being disruptive. And like, once they got put on ADHD meds, like things went from night and day. The kid went from getting C's and A's. He's one of the best kids in the class now. And the kid's happier too, because now, think about it, like now he actually has friends. Because before, people didn't want to be friends with him. Where do you live? Guess. See if you can guess where I live. Maybe I'll switch up the view here. Switching up positions for you. Oh. Rip. So you're saying my childhood could have been fixed with meds? No. Well, I mean, what's done is done in your childhood. All you can do is level up now. That's the most important thing, right? What's done is done. There's no point in hating the past. What's done is done. No, I don't live in Alabama. I grew up or I went to college in Alabama and med school in Alabama, but I don't live there. I live in NYC. Actually, let me ask you something. So, who here is a provider? Like if you're an NP or a PA or a clinician or a doctor or like a therapist, who here is a provider? I have a question I want to ask you. Doctor, LMT, okay. Okay, so let me ask you my question so I can pee. Yeah. So something I'm thinking of is creating another program to where I teach other providers how to get started, how to grow on social, how to get started on social media, how to grow on social media, like how to get an audience, and then how to make money on social media. Basically, how to grow, get followers and then make money. Because like this is literally my life right now. It's 3 p.m. on a Thursday. I mean, I get it's a holiday, but like this is literally my day-to-day life. Is I work from home when I want. I do social media, and I'm in New York, like literally living that New York influencer life. And something that I figured out. But I know a lot of healthcare providers, they feel like their jobs aren't that good. They're just cranking out patients, feeling burnt out, moral injury, all of that stuff. And now like I have the freedom to live how I want to. So my question is that would this be of interest? Like would knowing this, like know how to start on social media, grow on social media, get an audience, how to make money online, like would that be of interest to you? That's my question. Like, is that something that you'd want to know? Because I think it's so valuable that if you're able to grow on social media and like you have an audience, then you can really live the life that you want to, and you can help people online too. So it's just something I've been thinking about over the last like couple months. I know a lot of people are scared to start on social media too, right? They feel like people are gonna judge them or hate them, or they feel like they don't know how to post, or they're self-conscious or whatever. Yeah, so I'm just wondering if as a provider that would be of interest to you. See, for example, Savannah, you're saying, I don't know how you worry about your workplace having a problem with social media use. Exactly. I don't have a workplace. I work for myself. So I can say whatever, do whatever, and no one's gonna have a problem with me. It's because it's me. I'm not gonna lose my livelihood from it, right? If people don't like me, that's fine. They can keep scrolling, and if they like me, they stay and chat and they vibe, right? They eat with me. So that's why it works itself out. So I'm not worried about what a workplace might think. So that's why I want to give you that freedom too, because a lot of people feel shackled to their workplaces because they're like, hey, my workplace says I have to see 30 one of my patients, she's a PA, and she said that she sees 30 patients a day. And I'm like, what the hell? Some of my NP students in my coaching academy, they're like, yeah, I see 25, 30 patients a day. The employer just says, okay, just keep cranking out patients because it makes them more money. And that's not a way to practice, not a way to live, just to crank out patients like that. So that's why, by being able to live online like this, like to have a social media following, it gives you freedom. So like, I have my own private practice, I have a coaching program, and so I'm literally able to live this kind of life like that. It's literally the influencer life. And so I'm just wondering if that is something that I should pursue in, like if I should expand energy into. Because I feel like many people want to learn how to grow on social media. They just don't know how. Definitely feel shackled, exactly. The jobs shackle you. Like now I feel free. I woke up at like 10 today. I go to bed around 1. Like I can wake up whenever. I can go to sleep whenever. I took a 10-day vacation to Iceland because I was like, hey, I wanted to go with my family. So I just went. Like I didn't have to take off or request vacation. But it's not lucky though. It's not lucky. It's like, I could have gone the standard psych route, but I was like, no, I want to work for myself. So I learned about business. I created a social media brand, right? That's why I'm literally out here yapping. So it's not luck, but it's rather work. So I want to teach other healthcare providers how to do that. So, but basically, I'm just wondering if that's actually something that people would want to be interested in. That's all. Have you been to Asia? Yeah, like you can literally travel anywhere. Like influencers and like people who make money online, they live in Bali, Thailand. I mean, yeah, Thailand, South America, Mexico, Cancun. Like they live everywhere, so you can literally travel whenever you want. He learned about yapping. Yeah, I don't even fucking yap. Like I don't talk. Like I'm the type of person. Like I like other people talking. When I go on dates, or like when I start like seeing people or like in past relationships, like I like girls who are talkative because then I can shut up. Like I don't like talking, but it's a skill set that I had to learn to do online. But yeah, anyway, that's what I'm wondering if yeah, that would be of interest. Should I open up my own practice as a psych NP in Long Island? Only if you feel confident, only if you've had some experience, because the problem with the practice is that you really are on your own. And so as a psychiatrist, right, I've had my full residency and fellowship and I moonlight and I still get mentorship. So I'm constantly learning, and when you have a whole bunch of patients on your own, like you don't have anyone to bounce off of. So I would say only start a private practice if you have some experience under your belt, and so you're able to prescribe independently. So yeah, so that's what I would say in terms of that. But if you do decide to do that, or even if you don't, you still want to get mentorship because you want to be able to discuss cases, you want to be able to staff cases, you want to get feedback on cases. So that's super important to do that, Talha, right? To get feedback. And so that's why, joining a mentorship group can be really helpful for you, because now you're not just doing it all on your own. You're getting guidance on how to open up a practice, and you're getting guidance on like clinical cases too. Like, hey, I had this tough case come up. How do I handle it? Now you have me to help, and plus you have other NPs to bounce off of too. So that's I think a real advantage you get if you join a mentorship community. What's PMHNP? It's psychiatric mental health nurse practitioner. How do you care for your mental health after a hard day of work? See, that's what literally I was saying, is that I get to control my schedule, so I don't have a hard day of work. I mean, like sometimes I do. Like Wednesdays, what I do is on Wednesdays I see all my patients. So I was literally seeing patients from like 10 a.m. till midnight yesterday. But I like that. And then like today is like a chill day. I have 0 patients today. So I'm doing more social media stuff, more business stuff. Like I worked out, went to the gym for 2 hours. So that really helps me. And then plus eating healthy. You're selling social media pretty hard. Let's hear about how you practice. Yeah. I mean, you're literally on a social media platform. If you want to hear about how I practice, just go to any of my videos and you can watch them. Do you think medication is fully bad? No, it's a tool. It's just a tool. It's not like a good or bad thing. It's just a tool. Try rewording that. You eat healthy, but you drink when you socialize. I do, yes. So that's why I do this. I eat healthy for 80-90%. So that way when I go out, go socialize, like it's my birthday this weekend. So I have a birthday party this weekend. So yeah, that's why I make sure that the core foundation is healthy. So that way I can like sprinkle in other stuff and have fun. It's just you did a podcast with Dr. Yosef. Yeah, so watch the podcast. and come to your own conclusions, right? That's the important thing. Happy birthday in advance. Thank you. I appreciate that. Advance, happy birthday. Yes. If everyone needs a psychiatry, then why do doctors get degrees? I'm not sure what that means exactly. Do you eat dairy or gluten? Yeah, I eat both of them. For dairy, I only eat Greek yogurt, and for gluten, like sometimes I'll eat bread, but I try to avoid both of those things. I believe that both are inflammatory. Soda and harm? Soda and juice does so much harm for the mind. It does. They cause a ton of inflammation. I agree. I absolutely agree. Soda and juice are terrible. Just absolutely terrible. Since you're a psychiatrist, do you think Huda is mentally okay? I don't know what Huda means. I don't know what that is. Also, if you like this, definitely double tap the live or double tap the thing so that way you can like it. And that way you can spread it to more people. I eat the same time every day and eat the same food every day. You're so sweet. Thank you. I appreciate that. You don't see patients. I do see patients. I see patients on Wednesdays. So if that interests you, like if you're wanting to become a patient, you like my style, you like my vibe, you feel like I can help you, just book a consult in my bio and we can see if we're a good fit. Do you also have a psychiatrist? I do not know. What is your dessert? We are about to see. Why is it never supposed to? Yeah, we are about to see the dessert. What state are you licensed in? If you go to my consult page, you can see all the states, but it's like New York, New Jersey, Pennsylvania, Connecticut. There's like a whole bunch. But if you just go to my consult page, you can see all of that. Should you stop Focalin if you're trying to get pregnant? Yeah, ideally. You don't want to be taking that when you're pregnant. Stimulants are not the ideal if you're pregnant. Curious because I'm cutting down on sugar. Yes. Well, here's the start. So this is what I call my dessert bomb, and pretty much I eat this every single day. Am I wrong for going to clinical psych because I don't agree with meds being prescribed for long-term use? Yeah, it's up to you. You are in charge of your own life, and I think the faster you realize that, the more freedom you'll have, because no one can tell you how to live your own life. But yeah, so this is my dessert that I have every single, well, most days. And pretty much, so it's Greek. I call it my protein bomb dessert. So Greek yogurt, I think of it like an ice cream. It's pretty much ice cream to me. Like it's like I love ice cream, and it's kind of like a base of ice cream, except way healthier and way more protein. Like, you know, like 100 calories, there's like 18 grams of protein in this. So like a scoop or two of this is like 200 calories, if that, and so much protein. Yeah, honestly, Greek yogurt's the biggest dessert hack I've ever come across. That and like protein bars. But so see, that's plain Greek yogurt. Now we got to give it some flavor. And then what I do, so I get some protein powder. And then basically just put the protein powder in there. That is a lot of yogurt, yeah. Yeah, it's bitter, but that's why you gotta mix it, right? So see, now I have protein powder, and so now it gets like the taste of the protein powder. I mean, you can use any protein powder. I just have two. I have vanilla and chocolate. Sometimes I'll use vanilla, sometimes I'll use chocolate. I prefer soy protein over whey, but it just suits my stomach better. What if you ate ice cream instead? Well, I wouldn't also get 40 grams of protein. If I ate ice cream, I would get 5 grams of protein. and a whole bunch of sugar and stuff. Can we add fruits? Yeah, just you wait. Just you wait, flower child. So then we gotta stir it, make sure that's good. Get the vanilla really in there. Yeah, and then basically the nice thing about protein powder is you can get whatever flavor you want. So you just use the flavor that suits you. What if you got 5 grams of protein instead of 40? Well, I would rather have 40 instead of 5. So that's the decision I want. I'm gonna get the ingredients for this tomorrow. Yeah, if I had stocks like this, it would be great. But yeah, I would rather get 40 grams than 5 because gains and summer and all that. Anyway, so that's that. And then, then we got blueberries. So I just mix a bunch of blueberries in there. I see. We have a troll in the midst, huh? Oh, you got it. Of course. Why would I be diagnosed with BP type 2 in my 20s, went off my meds years ago and have no symptoms? I'm not sure. Sometimes BP can get better as you age. Yeah, so then I just put in a bunch of berries in. I like frozen just because it's, they don't spoil. That's really the main reason. But then when you put the frozen berries in and you mix it with the Greek yogurt, they kind of melt, so they become soft enough to eat. So I do that. Yummy, best dessert. Yeah, it's so good. Is more protein always better? Well, so I weightlifted earlier this morning. So I have different fitness goals than I guess the average person. But protein is also really good for satiety, helps keep you full. You have a bowl of ice cream, you're gonna feel full in a minute. Whereas a bowl of Greek yogurt will keep you full for hours. Why don't you shave your armpits so that way you can see all the goodness right there? And yeah, see, if I had a workplace, I'd be like, oh, you're not doing this, you're you're doing that. But see, that's why you don't need a workplace. You gotta work for yourself. But anyway, so that's that, and then I like to add in some, it's best frozen because it feels like eating ice cream. Exactly. All right, I think Apple user, you are definitely trolling, so I'll get rid of you. What was I gonna say? How many grams of protein? Yeah, so the yogurt's about 20, the powder is about 20 as well, and then I add in some more to make it chewy, because the best protein, I think, or the best Greek yogurt, it's better when it's chewy, so I think it's better this way. So that way, yeah, it does taste like ice cream. And then, yeah, I add in some of these pumpkin seeds for a little bit of health benefits. So your patients on Wednesdays, your own private practice? Exactly, yeah. So Wednesdays are my clinical days where I see patients. Is private practice hard to do? Yeah, it takes time. Looking small, says the guy with no profile picture. Yeah, and 19 followers, nice. Vanilla is better, it just depends on the flavor. May I ask how old you are? Just curious. Guess. How old do I look? Did you always know you wanted to pursue psychiatry? Yeah, I always knew that when I went to med school, I knew I was going in for psych. 35, it was 25. And then I put in some chocolate. So I got some Icelandic chocolate, and I'll break the chocolate into, actually I'm gonna use a different chocolate. That one's a little harder to break. Yeah, you look 23, TBH. Yeah, I'm 31. I'm about to be 32 in a month, or in a couple days. Sorry. I love psych, but it's not my passion. Yeah, then is this dark chocolate? Yeah. Oh, damn. I had those big ones. I just can't find them. Yeah. So I like to put in a piece of dark chocolate because it like makes it chewy and it gives it taste. How is the stylish white Hispanic content creator who is visiting you? I'm not sure who you're referring to. As a psychiatrist, you pay a lot of taxes, unfortunately. Canute says use a knife. Okay. Wow, that is good dessert. Oh, it's amazing. And it's literally like 45 grams of protein and maybe 500 calories. And then I'll mix in a little piece of chocolate there. And then mix all that shit together. And then boom. Now you see it's all there. What's your favorite part of it being a psychiatrist? How you push through years of school? I mean, you just gotta level up. See, once you enter med school, like once I entered med school my first year, I was 50K in debt because my tuition was 30K and then living expenses is like 20. So I was already 50K in debt. So I have to go through it. Otherwise you can't pay the debt. Bro said level up. Yeah, you gotta level up. That's it. It's like if in a game, if a hard boss comes to you, either you fight the boss or you die. And then if the boss beats you, how can I schedule for PMHNP coaching? So just send me a message or look in my bio and you can see the link, either or. Either or. They're saying, hi, the debt is real. Mine was 270K. Yeah, mine was 200K. Good to see you, Dr. Kirsten. So check out our podcast. We did a podcast together on women's mental health and like perimenopause and pregnancy and stuff. So definitely check that out. But I forgot what I was saying. Oh, the debt, yeah. So I was 200K in debt when I finished. But basically the whole point is like once you get in, like you're locked in, you're not going anywhere. So yeah, you got to level up and finish. Like either that's what you do. Either you drop out of school or you level up and you get through it. Just like if a hard video game boss beats you, either you quit playing the game or you level up and you beat the boss. Like those are your only two options. Tips with someone with GAD trying to get through OSCEs in med school. It all seems to throw me off. What makes OSCEs so hard with GAD? OSCEs are like, they're fake patient encounters. Like they're just acting. Like, hey, I'm a patient. Like, nice to see you. Like, you're just acting through it. Hook me up. I'm a health nut. Maybe study for the OSCE. You're right. Like, you just get through it just like you got through step 1 and step 2 and all that other nonsense. MCAT. Can I try to eat your sweet yogurt? Do you have to go to the toilet before? I'm not even sure what that means. Ain't no thing, yeah. I enjoy the real patient encounters more when I'm thinking about the examiner's thinking about, yeah. It's just a game, right? Once you realize that all of life is just a game, life is just a video game. And that's what you got to level up to get through the game, to get through the different challenges of the game. And you just have to do the actions to get you the result. Just like if you're trying to beat X Pokemon in a game, or you're trying to beat the Elite Four, you just got to do the right actions and then you go through it. So similarly, like, if you have to get through the OSCEs, you figure it out, you do what you got to do to get through the OSCEs. Like that's literally it. Bro, this is so good. And I think someone had said earlier that frozen berries is like ice cream, and I agree. I'm going to start using that. Does it affect you mentally after dealing with some patients? It can, yeah. But I'm pretty good at separating. I think that's a good skill to have, being able to compartmentalize. And that's why I do patient care now mainly 1 day a week, so the rest of the day I can focus on other things. I'm just going to block you, bro. Thoughts on Ambien? I read that as thoughts on Epidemic. Thoughts on Ambien? It's strong. It hits like a truck short term, but it's not good long term. I take it you never suffered mental health. I had some confidence issues when I was younger, but then I realized that either you level up or you get stuck with it forever. Like I've seen a therapist before. I had social anxiety, so like I got exposure to therapy. I joined a fraternity, and that really helped. Do you have any book recommendations? I mean, I read lots of books, so it depends. Fictional book wise, I'm reading Fourth Wing right now. I'm actually reading the second one, Iron Flame. Non-mental health, non-fictional wise, I'm reading the book called Influence. It's about like persuasion, how to be more persuasive. Yeah, I was reading. What else was I reading? Psychiatry wise, I was reading. What was I reading? Oh, I was reading The Anxious Generation by Jonathan Haidt. So yeah, definitely different books based on other things. Have you read Stormlight Archives? No. I was also thinking of reading like, is it A Court of Thorn and Roses or whatever it's called? Yeah, that was next on my list after I finished the Fourth Wing series. I'm on Cymbalta Thoughts. Yeah, I like Cymbalta a lot, especially for chronic pain and anxiety. Do you have a boyfriend? Do you have a boyfriend, Steven? Connection between ADHD and addiction. If you have ADHD, you're more impulsive, so you're more likely to struggle with addiction. Yes, I do. Good for you. Advice piece, IMG here, USMLE is done, had to pursue MASH due to dialysis. Meanwhile, I'm meant for PMHNP, about to finish, still aiming for PsychMD. Think that's a smart move? No, I think you should rather maximize on your PMHP, which you already have. I mean, you can still try to go for the match, but it's probably going to be, Psych is getting harder and harder to match for sure. If you can do it, sure. Or you could just maximize on being in PMHNP. You're going to be practice the same thing. God, so rude. It was a question. I wasn't rude to you. Can psychiatrists offer therapy or just treatment? Both. What kind of music do you like? I listen to R&B. I also listen to Punjabi music when I'm at home. Or not at home, at the gym. Recommendations on self-help or level up books. It depends on what category. For example, I read books on leveling up in business, in my social life, for my social skills, like how to win friends and influence people is classic. I read books on how to level up in psychiatry, dating, all of that. So it depends on what area you're trying to level up. Fitness. Your teeth are so white. Appreciate it. No, just I think it's just good brushing. That's all. I take 300 milligrams of Luvox, 2 milligrams of Abilify, 1 milligram of clonazepam. I lose 50 pounds. I've gained 50 pounds. How do I lose them? You eat like this. Basically, weight gain is a function of calories in, calories out. Weight and what you eat. So if you eat salmon and broccoli and Greek yogurt, you're gonna lose weight because you'll feel full and you don't want to eat anymore. If you eat like pasta and chips and cookies and all that, you're gonna gain weight. And all the best binge foods are weight gainers because they just have a lot of calories and they don't keep you satiated. Appreciate that. Yeah, of course. Hope that helps. Hannah says, what do you think of TMS or ketamine? I think they're good second and third line if you've tried some stuff and it hasn't worked. I wouldn't jump to them right away, but I recommend them for people who've maybe failed a couple things. How do I control impulsiveness on I'm not sure what that med is. In the UK, it's shit lol. I'm on quetiapine, 400 milligrams. Yeah, that's a solid dose. That's a big dose. Can lithium be taken for anything except bipolar? My psychiatrist prescribed me for no bipolar. It can be taken for bipolar, yeah. Also for impulsivity and SI. What are your thoughts on mid-level encroachment? It's like, see, this is the kind of stuff I'm talking about. I don't think that mid-level encroachment is a thing. I think it's just insecure physicians who are talking about encroachment and speaking on it because I feel like they might lose their jobs or whatever. In reality, we're all here in this together, and there's more than enough patient for all of us. So I think it's better. I think it's more important that we all work together rather than doctors and NPs fighting us amongst each other. What's in the bowl? Greek yogurt, protein powder. Also, I don't know what Elevance is. I think you have to check your spelling. Is sertraline addictive? No. Earlier this week, you suggested a bump to 90 of Cymbalta to help with depression. Already feeling relief. Awesome. I'm glad that it helped. I'm going to screenshot that one. Sorry if my question offended you. No. I don't take offense to anything. Literally, nothing you could say could ever offend me. Because remember, offense is it's a choice. You choose to get offended. Never forget that. Two people could hear the same thing, and one person could get offended, and one person could not. So remember, you always choose to get offended. And people like getting offended because it makes them feel good, and they feel angry, and they feel something. But you choose, so I'd rather just choose not to be offended. It's like, just laugh it off. It's not a big deal. Okay, here's a perfect example. You choose to get offended. Let's say I plug in my ears and you tell me that I am a loser or whatever. If I might get offended if I heard you, but if I don't hear you, I'm not getting offended because I didn't hear you. So it's not that you saying it is causing the offense because I didn't hear it the second time. It's me hearing it which caused the offense. So if I didn't hear it, I'm not going to get offended. Thus, the recipient is the one who chooses to get offended, not the person saying it. Yes, the person saying it shouldn't be saying offensive things, sure. But ultimately, you choose to get offended. Like, you could insult me, and I'll be like, whatever. You could insult the other guy, and they'll punch you. So that's the difference. Elevance is the brand name for illicit dexamphetamine. Actually, it's Vyvanse, so I would check that. But Vyvanse is a low 20 milligrams is a low dessert. Exactly, like someone telling you off in a different language. Yeah, they could be saying the nastiest, rudest stuff, but because you don't understand it, you're not going to get offended. Thus, you are the one who's choosing to get offended. It's not the person saying it they might be being offensive, but that doesn't mean you have to get offended. Give them back the problem, right? See, that was some game right there. That was some game. So, yeah, if you like that, definitely like the live, because that way it'll get spread to other people. Thanks for the advice. I'll try that. I'm getting easily offended. Remember, you always choose it, so just choose not to get offended. You just say, "Hey, this isn't going to offend me," or "I'm just going to laugh this off," or "This is not a big deal," and then it won't be. Don't give other people the power to change how you feel. Damn, dude. Wow. Yeah. Yeah, don't give other people the power to change how you feel. Think about it like football. People, like, let's say you watch a sports team, your sports team, and then they lose and you get upset. You are literally giving people on the TV power over you because you're letting whatever they do get you upset. Yet they're not even in the room with you. They didn't say anything to you. They didn't do anything to you. They're just doing their thing, and you're choosing to get upset. Yeah. So remember, you always choose that. Yeah. So if you like this, definitely double tap too. Is there a way I can pin a comment? Hold on. Oh, nice, that worked, yeah. You got me feeling like Pavlov's drop because every time I see you start drilling, it's so funny. LOL, that's a good line. Why aren't you if you work? Don't give your enemy a seat at the table. Ooh, I like that. That's a good title. That person is right. Ella Vance. Well, in America, we say bye Vance. And as Americans, we only love and care about America. Hey Nick, good to see you, man. Yeah, I was gonna make you a mod, I said, so let me do that. But yeah, we're literally just about to end too. I think we've been live for a hot minute. Why are you here if you work? No, I don't work, I'm just lazy.